Okay, we're going to discuss the coxal bones. You have two coxal bones. What we're looking at here is the entire pelvic girdle. The pelvic girdle is composed of a right and left coxal bone. Also, you'll hear these bones referred to as os coxa or innominate bones. And then in the midline, you will have the sacrum. So you actually have a connection to the vertebral column with your hip bones. We're going to talk about the three main portions of the coxal bones. These are going to be separated in juveniles and then will eventually fuse together in the acetabulum. So the first one we're going to talk about is the ilium. And this is going to compose the largest part of the os coxa, and this is also going to be the most superior portion of the coxal bones. There are a few features that we want to discuss. The first we're going to talk about is the iliac crest. And you'll have an iliac crest on either side. When you put your hands on your hips, you are palpating your iliac crests. These are going to be the superior margin of the ilium. And this is going to be an attachment site for your abdominal wall muscles. Now, the most anteriorly projecting portion of the iliac crest is your anterior superior iliac spine. You'll also hear this referred to as your ASIS. This is going to be the lateral attachment of your inguinal ligament. Also, you can palpate this as well, so kind of the point of your iliac crest. And this is a very important landmark to locate or describe during surgical incisions. It also serves as an attachment point for your sartorius muscle. Now, we're going to look at an individual coxal bone in a moment, but I want you to get an idea of where your sacroiliac articulation is. So you can see right here the wings of the sacrum are articulating with the os coxa here. This is going to be a type of synovial joint. Okay, next we're going to talk about the ischium, which is going to be more posterior-inferior. So I'm going to flip this over. So we're looking at an inferior view of the pelvic girdle. So the most prominent part of the ischium is the ischial tuberosity. So this is going to protrude posterior laterally. A lot of times you'll hear this colloquially referred to as your sit bones. So kind of what you're sitting on when you sit in a chair. This is going to be an attachment site for your sacrotuberous ligament, as well as your many hip rotators and your hamstring muscles. Now, extending medially, you're going to have your ischial ramus. So the ischial ramus extending medially from the ischial tuberosity. This is going to attach to the ramus of the pubis, and you'll have your ischiopubic ramus right here, forming the inferior border of your obturator foramen. Okay. Now we're going to flip it back over, look at an anterior view, and we're going to look at the anteriormost bone of the os coxa, which is your pubis bones. You're going to have one on either side. It's going to be anterior-medial. And you can see here that they're going to articulate with one another anteriorly in a symphyseal joint or a symphysis joint, which is a type of cartilaginous joint. When we look at the individual bone, you'll see that there's a very prominent symphyseal surface from where they connect. So in life, you're going to actually have a fibrocartilaginous disc right in between. Now, as we discussed before, you're going to have the inferior pubic ramus, which is articulating with the ischial ramus. Looking up at this portion right here, so a more superior portion, is the pubic crest. So this is forming that superior border of the pubis. This is going to be an attachment site for your rectus abdominis muscle as well as your pyramidalis. One other thing I want to note here is your pubic tubercle. So it's going to be medial in terms of your pubic crest. This is going to be the medial end or the medial attachment site for your inguinal ligament. So your inguinal ligament during life would attach from your ASIS down to your pubic tubercle here. Now we're going to take note of your obturator foramen. This is very large foramen here. Obturator means to occlude or to stop up, and this is named this because during life you're going to have a membrane that completely occludes this foramen, your obturator membrane. You'll have some neurovasculature that will travel through here, but for the most part the membrane serves as an attachment point for muscles. So it really minimizes the bony mass, but still provides that extensive surface area for the muscles. This will serve as an attachment site for your obturator externus and internus. Now, if we're looking at a lateral view, there are two features I really want you to focus on. You're going to have your greater sciatic notch. The greater sciatic notch during life is going to be converted into a greater sciatic foramen by your sacrospinous ligament and your sacrotuberous ligament. So it'll go across right here, forming an actual foramen here. Piriformis muscle and many nerves are going to leave the pelvis for the lower limb. They're going to pass through this foramen. And probably the most important one to know is your sciatic nerve. And one thing that I forgot to talk about when talking about the ischium is this ischial spine right here. So it's going to form that medial border of the greater sciatic notch right here. And this is going to be the site of attachment for the sacrospinous ligament. Okay, the last thing I want to discuss with this specimen is the acetabulum. So this deep cup, so really the socket for the ball and socket joint of the hip, it's going to articulate with the femoral head. And all three of those primary bones, the ilium, the pubis, and the ischium, are going to form the acetabulum, and that's where you will have fusion, right in the middle here. Okay, so I'm going to move the pelvic girdle to the side, and we're going to look at an individual coxal bone. So it's different. It's a little bit more difficult to get oriented in terms of what you're looking at when you're looking at an individual bone. But let's try. So we're going to have the ilium, which is going to be the blade-like portion here. You have your acetabulum, that's fairly prominent, so you know that needs to be lateral because it's going to articulate with the femoral head. You have the larger ischial tuberosity, that's got to be posterior-inferior. And then the pubis right here needs to be facing anterior-medial. So you can position yourself in terms of that. A few things that weren't as obvious that I want to discuss on the individual bone. If you're looking at a medial view, you see the symphysial surface of the pubis. So this is going to unite with the other symphysial surface of the other pubic bone. And that's where you're going to have the formation of that symphysis, the pubic symphysis. This is an important area in terms of determining age at death in skeletonized individuals. Another symphysial surface that I want you to pay attention to is the auricular surface of the ilium. So you see this ear-shaped portion of the bone. This is where you're going to have articulation with the sacrum. So that is also medially oriented as well.